As we have seen, we really needed Mobile Health International for a sustainable health facility in areas which are really underserved. But providing medical assistance for the unreached in South Sudan, it's only the beginning.
For someone that's sick, trying to get themselves to a health clinic,
having to walk possibly, 15 kilometers.
They take long and on foot. Reaching there, the sickness worsens and the child dies.
A lot of people die needlessly because every disease they're dying from is preventable.
And our dream is
providing lasting medical care for the people of Kaji in South Sudan.
We really first go and have a meeting with the community leaders.
And really ask them what they needed.
And then we also tell them what MHI can be able to provide to fit in or to fill the gaps that they have.
So for our clinics, we're committed to coming every few weeks, and the communities decide how often we come back. But we do initial outreaches, and then we follow up, and we continue to come back and continue to give medicines.
And our desire is to raise them up and to give them the equipment and the education and the freedom to empower them to run this program.
We are thinking that in time to come, where we are here, we'll have a static health facility that they can access anytime.
And in that process, we're not only giving medicines, we're training local people that live in that community how to treat themselves and giving them basic preventative health knowledge.
Letting the community choose at least 2 guys, MHI will be able to train these people to diagnose simple cases of malaria, diarrhea and respiratory tract infections. In that way, these guys will come back and manage these small health things we are setting in the facility.
We really focus on women and children. Women here carry the workload. They carry the burden of all of that. And we really want to improve our women's services so that those women that can't always make it to a health center, at least we're there, and especially the ones that are pregnant. Sudan has the #1 maternal mortality rate, so we want to improve the community's understanding of a healthy pregnancy, a healthy delivery, and taking care of a baby and the mother after delivery, and that is one of our prime focuses.
We're supporting everything that we do with basic laboratory tests. Simple blood work analysis, simple stool analysis to accurately diagnose the diseases that we're treating.
We want to work with the community. We want to bring that community ownership.
That's why Mobile Health International comes in and saying we are giving you with half of the price so that they can be able to access these things. We still channel this money back to the community so that in the future, even if mobile health pulls out, the community will be able to sustain something.
We want them to own this program. As MHI, we are working with them. We want to empower the community. We want to instill the spirit of self-reliance.
We call them community days, and in these community days, we come alongside with the community. We construct latrines, we dig pit latrines,
so that it will promote the ownership of the program.
One thing that we really focus on is evangelism. And so we don't go to any village just to do medicine, we go to take the gospel of Jesus Christ.
We want people to know that Christ is there and He can do healing.
The medical care truly is an opportunity for us to serve so that they can know the hope and the freedom of the gospel.
The goal of MHI is to bring the love of Jesus Christ.
That's how Christ was. He shared with people and he stayed with people.
Show people that the Lord truly does love you and He cares about you, and He's given you the ability to make a difference for your children.
And as long as the Lord has me here, I'm going to be building up the local people.
Truly, this is something for the Sudanese, and this is to be run by the Sudanese.
It's a big joy for me to serve my own fellow Sudanese.